Good morning, everyone. Thank you for coming here today. It's nice to be in a room with so many friendly faces, people from Horizon, people from government, people from the media. It's my pleasure to be here with everybody today. Before we begin, we want to respectfully acknowledge that New Brunswick is situated on the unceded, unsurrendered territories of the Wolastoqey, Mi'kmaq, and Passamaquoddy peoples. We seek to repair and rebuild meaningful relationships with Indigenous peoples and honor these lands which hold the hopes of future generations, all our generations. It's great to be here today to participate in an announcement that will improve access to primary care health in this community. I am pleased to officially introduce today's speakers. We will hear from Premier Susan Holt, Ashley Calvert, Vice President Community at the Horizon Health Network, and I'll be saying a few words myself. At this time, I'd like to ask the Honorable Premier Susan Holt to come to the podium and explain why we're here today.
Thank you very much, Doug. You can take my seat if you like. We're gonna do a musical chairs. There you go. Thank you very much, Dr. Dornan, and thank you to everyone for coming. It's great to see so many members of the community here, both members of the municipal team, Mayor, it's great to have you here, MLA Bacchus, thank you for being here, and lots of members of the health community, both in this facility and beyond, for this exciting announcement. Improving your access to primary care is our government's #1 priority. And so that's why I'm really pleased to announce today that we will have our 9th collaborative care clinic in St. Stephen with a $3.6 million investment from the provincial government in a new and dedicated clinic that will not be in the hospital and that will also support more healthcare professionals being added to this team and more people coming off of the patient wait list for care in St. Stephen and in the surrounding areas. So we had... Our government made a commitment to transform how we deliver primary care with a collaborative and team-based model. We committed to establishing 10 clinics in our first year in government in 2025. And so today, the team here at the Charlotte County Hospital had jumped on that. The team from Horizon jumped on it. They pulled together people and leadership to build a collaborative care team and to use the space they had to start serving patients and to start taking patients off the wait list. But we want to go further, and we want to make sure that this community has that dedicated space. We want to free up this hospital because it is bursting at the seams and could use that space in different ways. So this community is going to get purpose-built space designed exactly for that primary team-based care, thanks to the professionals here who have contributed to its design. These funds are going to help them grow the team and add more healthcare professionals, a diversity of professionals from nurse practitioners to family doctors. The mix will look different depending on who's interested in staying and what this community needs. So we can imagine social workers, mental health counselors, and others to join this collaborative team, because the ultimate goal is to get people the care they need and take people off the wait list. Nous sommes vraiment fiers de l'équipe qui sont ici et l'équipe municipale qui pousse pour leurs résidents et d'avoir cette promesse et cette fonds et cette action de notre gouvernement pour améliorer l'accès aux soins primaires pour les gens de cette région. So I want to recognize the leadership of the folks at the municipality who have been pushing for this consistently, who have been helping, as we knew it needed different space, and we're, okay, where can it go? Where might we find? There was suggestions, there was options, there was a lot of dialogue about what's best. I wish I could tell you the location, but we're just dotting the I's and crossing the T's on that lease negotiation, so that'll be good news for another day. I know it's probably not much of a secret in community, but we're getting the final parts of the lease done. and it's going to be an amazing place, a really desirable place for healthcare professionals to come and to join this team and to make sure that we're serving the people of this region. One flag I want to make to the folks who are listening, because this is a question we often get at these announcements, is that we want you to be on HealthLink. I know we've seen the numbers of people registered on HealthLink go up because as we're building out this clinic and adding professionals to it, we go to HealthLink to take patients from HealthLink and attach them to this clinic. So we want you to make sure that you're registered on HealthLink, that it has your up-to-date phone number, your up-to-date address, your up-to-date email address. Maybe you think you're on the list. It's worth double checking because we're going to use HealthLink to take patients off of that waiting list and attach them to this team of healthcare professionals that are going to deliver excellent preventative and primary care in this community. So with that, I'll let my colleagues, Ashley and Dr. Dornan, speak a little bit more to it. And I just want to reiterate my personal thanks to everyone who's been involved in advocating for this community, for advocating for a solution that reflects what our healthcare professionals, we've got Dr. Saber here and others, Yvonne, one of the original nurse practitioners, they're telling us what they need, what this needs to look like and how it will work best. And we know that that'll make it extremely attractive to the healthcare professionals that are going to want to come and join these incredible folks to serve this incredible community. So thank you for the leadership that's been provided locally. It's a great day. We're excited to see this $3.6 million turn into that dedicated clinic and more people getting off the wait list and getting served here in beautiful St. Stephen. Thank you.
Thank you, Premier Holt, and good morning, everyone. Today is a great day. I'm so pleased to be here in St. Stephen to celebrate the funding announcement for the expansion of the Charlotte County Collaborative Wellness Center. It is an exciting day for Horizon because it represents real progress in our work towards strengthening primary care within New Brunswick. As we've shared before, our primary care strategy will create a better experience for patients and providers alike. By developing collaborative care teams and building family health teams, we are changing how care is delivered in our communities within this province. In the last year alone, we have added 7 health professionals to this team and have onboarded 310 new patients to the patient roster. That is 310 individuals and families who now have access to trusted health care within their community. With the support of other local physicians, this team has also opened an access clinic to provide transitional care for unattached patients for non-urgent medical needs. The access clinic reduces stress on the hospital's emergency departments, and since its opening in February, has seen more than 2,000 unattached patient visits. What makes these announcements so meaningful is the local impact. This expansion will allow the care team to continue growing services and expanding access to primary care. In the coming years, this clinic will increase its clinical space, recruit additional primary care providers and allied health professionals based on the needs of the community, and further grow their patient roster. This team will continue to work side by side, sharing their skills and knowledge to provide comprehensive care for residents. The approach helps ensure that patients get the right type of support for their needs when they need it. We know this model is not only good for patients, but it also helps to support our healthcare providers and our workforce by creating a more sustainable way to work and practice. Providers are not working alone in an isolation, but are part of a team backed by resources and having shared responsibility and collaboration in providing care. Through the establishment and growth of teams like this one, we can shorten wait times, reduce pressures on our emergency departments, and give patients more consistent access to the right expertise for their care. Horizon's goal is an ambitious one. By 2029, we will have every patient in the communities that we serve matched to a family health team. Each care team, including the one here in Charlotte County, brings us closer to that reality. This progress would not be possible without the support of our partners, including the Government of New Brunswick, and the dedication of the Horizon staff and providers who've embraced this vision and who work tirelessly every day to make it a reality. Today is about creating a stronger foundation for primary care in our province, one community at a time. I'd like to welcome Minister Dornan back up to the podium. Thank you very much.
Thank you, Ashley. You know, we're so pleased to be here in St. Stephen. As a clinician, I used to drive down here to do endocrinology clinics, and it was such a warm environment. And from those days that I drove here to see the start of a collaborative care team here in the hospital. As Premier Holt and Ashley have mentioned, this is exciting news. You know, I do communicate in the legislature with Member Bogus on a regular basis. When are you going to start my clinic? It's today. We are thrilled to be here today to support the expansion of the Collaborative County Collaborative Wellness Centre. Know that this means more people in St. Stephen will be able to get the care they need at the right place, at the right time in their own community. I know that this team has already been working hard at growing its staff, connecting more people with primary care. They have outgrown the capacity of the clinic in this hospital. In fact, the team has added 7 healthcare professionals and attached 310 patients, as we heard earlier, without a provider since February. And I know the team is looking forward to building on this momentum. As Premier Holt has said, more and more people are getting on the list so that they can come off the list, right? You need to get on before you come off. The work to expand primary care services and attach more people to this team here in St. Stephen will continue with this expansion. The funding being announced today will support infrastructure, not enough infrastructure in this building, and the recruitment of additional healthcare professionals. With a move to a larger physical location expected in the coming months, the team will have the clinical space to grow primary care services for the people of this region. And when we have the space, we can recruit more primary care people. Dr. Sauber is a lead physician in this team, but he has friends, and we have friends in the community. You know, there's not a single collaborative care team that started from a field. Every single one of them has had a starting node of people. Sometimes it's a couple of nurse practitioners. Sometimes it's 3 doctors. Sometimes it's a clinic like this that has 1 physician, 3 nurse practitioners, 2 registered nurses, 2 LPNs, 1 respiratory therapist, and 1 social worker. Isn't that what we talk about? People getting together to work as a team. When you have a bigger team, you can see more people. Someday you'll come in to see the social worker. Another time you'll come in to see the nurse practitioner. So, is it completely new? No. You have a node here that's been working hard away, and we're going to move to a new location where we'll bring in more physicians, more practices, more registered patients. These are the healthcare professionals who are making a big difference in helping people get the care they need when they need it. I should note, a key part of this effort was opening an access clinic that serves unattached patients with non-urgent medical needs. They can go to the clinic instead of going to the outdoor. In collaboration with local physicians that are here. Dr. Saber is one, but there's other physicians that have started to work with the team here, and we look forward to them coming on board in a more fulsome way. I understand that they will continue to provide episodic care for people in the community who do not have a provider, and for those with limited access to their current provider. And I love the goal, Ashley, 2029. Everybody will be attached. This is what Horizon is telling us. And we have similar expectations, realistic expectations from Vitality as well. I'd like to thank the members of the Collaborative County Collaborative Wellness Centre for the care that they provide to patients every day. I am proud to see the momentum to develop collaborative care teams to transform how we deliver primary care. You know, not only do we have a team that's coming together, we have good relationships with our physicians, with our nurses, with our nurse practitioners. And I was chatting with some people last night about how we can grow our nurse practitioner opportunities for mentorship in our communities. This is our 9th collaborative care announcement in 7 months, and we're not done yet. We have committed to 30 by 2028. Matt, my colleague, has my briefcase and a keep binder of all the groups of people that are looking at forming collaborative care teams. And everyone is in different stages of development, like this one is here today. We are collaborating with our healthcare partners, both of our RHAs and health professionals, to fully embrace this model. We're getting calls from across the country what this model looks like. We're the first that does a combination of salaried physicians, other health care providers, and fee-for-service physicians. It's unique. We will continue to work to increase the percentage of New Brunswickers who are attached to a primary care provider, especially through collaborative care. Team-based care is not only the model we know we need for better patient care, it also means better support for primary care providers. No one likes to practice in a solo practice, but if you can knock next door and talk to a nurse practitioner or a physician or a pharmacist or a social worker, it's a much happier place to come to every day. Collaborative care helps attract and retain healthcare providers. Our team-based care means people will be focused on care and not paperwork. All our clinics will be electronic. Expanding collaborative care teams is also an important step in reducing pressure in our emergency rooms and hospitals. As you know, many people spend extended hours in, I would say, all of our emergency rooms. We're going to help that considerably. And every one of those people could be advised, well, maybe you should go see your nurse practitioner. Well, I don't have one. Yes, you do. This community has everybody that's covered. When people have primary care providers and can see them in a timely fashion, they are much less likely to end up seeking treatment for non-urgent care at our urgent care hospitals. Improving access to primary care means better care for patients across our healthcare system. I'd like to thank everybody that's come out here today. I'd like to thank specifically the Charlotte County Collaborative Wellness Center and Horizon Health Network. I am proud of the progress we are making together, the support that we give today with this financial support that not only addresses space, but addresses recruitment for new people, and Horizon Health Network. We are proud of the progress that we are making, I'll say, in a relatively short period of time with our healthcare partners in expanding collaborative care and transforming the way we deliver primary care. I look forward to making further announcements over the next few years as we continue to develop, expand, and improve primary care throughout the province. Thank you, Ashley. Thank you, Premier Holt, and everyone else that's joined us here today. And with these remarks concluded, there will now be an opportunity to ask questions of our speakers here in the room. It's a scrum. Typically, we do a photo first and then a scrum. Today, we're doing it a bit reverse because the room is not quite amenable to a group shot. So what we will be doing is a scrum first with Ashley, myself, and Premier Holt. And following the media scrum, we'll be doing a group picture at a more suitable location. So thank you very much. Ms. Bacchus, you're the first. You're the first question of the scrum.
It was media, so any idea on an opening date? First of all, I want to thank you because I did bug you constantly about having a clinic here, and you promised one before the end of the year. So have you got an opening date yet, even a tentative one?
We're very close. We're almost signed off on a lease agreement, and so that will determine when the opening date is.
Then there's going to be renovations,
gonna
obviously,
say,
to get the
definitely
space fit out. But we're looking for those to be rapid renovations because this is going to open in 2026 and early, hopefully, in 2026. So we'll get the lease signed, we'll get it renovated, and we'll have people in
Perfect.
before the snow melts.
And so could someone check her media credentials? So Ashley could come up and maybe the media could come forward.
Do we need to move seats or can you do it from there?
Okay.
Perfect.
I will just give an opportunity for anybody that does need to leave.
Yeah, to
leave.
scooch.
So, yeah, right, that's, yeah, just wanted to check if everybody does need to, yeah. Nope, that's good.
We can do an audience scrum. Yeah.
Would you say gone are the days of having a family doctor?
No?
I'll get you to come to the mic.
Sorry. People may still have a family doctor, but there'll be a family doctor that's part of a team. And gone are the days when everybody has to have a single family doctor and that's all. We are promoting teams. In fact, when Horizon recruits now, they look for people that want to come and be part of a team. So yes, you may have a family doctor. Yes, you may have a nurse practitioner. Some clinics will have family practice nurses that are not quite practitioners. So no, the day is not gone. If you're in a clinic such as the one here, you may be seeing somebody one day, and you may call Dr. Sauber your doctor if you had to put a doctor on a file. So no, those days are not gone. I also had to remind people that there are some solo family doctors that will continue to practice in a solo fashion throughout the province, and we support them as well, though we hope they come together as teams.
And secondly, how well is recruitment going? Like, it seems like this model is attractive to new doctors, new nurse practitioners that are just getting out of medicine, going into the workforce. How big of a draw is this program?
It's huge. I have a briefcase, not of new doctors. It's of doctors that are practicing here that now want to practice collaboratively. And our government is providing the space for that, support for an electronic medical record, and the backbone of that, overhead costs, for example, nurse practitioners that work in the clinic. So when people come in, that's what they want. The people that are here, that's what the majority want as well.
Natalie.
The council here has done a lot of work on their own, creating a health committee. They've also allocated, I think 50,000 in this year's budget towards incentives for doctors. I'm just wondering if that type of work on the ground is helping you attract doctors in the gaps that maybe exist from maybe the health authority or the provincial government.
It's absolutely helpful. I mean, we came in with a real mandate and mantra to get out of the office, to work with the partners on the ground, to get out of one-size-fits-all models that tell people how they have to operate. And here we have a really engaged municipal council that took a leadership role and said, we're going to do what it takes to attract healthcare professionals for our community members. And Dr. Dornan and our team and the team at Horizon said, we're going to support you. What do you need? Okay, we need different space. Let's go find it. You want to make an offer of incentives to attract physicians? Great, we can support that because the folks here on the ground know why this is a wonderful place to live, and they can sell it when they get connected to healthcare professionals. They can sell why this is a beautiful place to be. So we've been working in partnership and really appreciate the leadership that the municipality of St. Stephen has shown.
And I'm just wondering, so you said 310 people have been able to come off the list, compared to the 8,000 roughly people in Southwest New Brunswick that are waiting for a primary care provider. That doesn't seem like a lot of patients. Is this a capacity issue because you only have one doctor and two nurse practitioners, or is it a space issue? Like, what is preventing you from taking more patients off the list?
It's a bit of both. So that's why this investment means new space that will have room for more patients and investment in more practitioners so that we can take more patients off the list, because that is the goal, is to get everybody attached as quickly as we can. And we can't do it here. This is not the ideal place. We have other uses for this space. So our government has made the commitment. We had to change policies and pass them through cabinet in order to be able to engage with the right community space that was going to work. But we've now found it. It's bigger, it's better, it's going to mean more healthcare professionals, and more importantly, more people getting attached to a collaborative healthcare team that will serve them and their family.
I'd like to talk about the community. We don't announce a clinic in any community that's not supporting us, supporting the efforts. If we can get people here, but it's the community that keeps people here, engages them, they're become members of clubs, they're sold homes here, they participate in golf courses, and so I can't underestimate the power of the community at partly attracting but mostly retaining people here.
Yes.
When you talk about the investment adding professionals to the clinic, does that mean creating spots, or does that mean people have been actually hired to take in the spots, or does that mean people being transferred in from other units?
It's mostly going to be hiring new people into the new physical space. There may be some people who will want to transfer because they're going to have custom-built, perfect space that's brand new for maybe the most enviable primary care clinic in all of New Brunswick. So I can imagine a lot of people may want to transfer here, but the funds are there to support new healthcare professionals being added to the team so that more residents can come off that wait list.
I'll ask the
Avery.
Premier and the Minister first. What are the different challenges or obstacles that come with a community care clinic in a rural community like St. Stephen compared to some of our bigger cities in the province?
So St. Stephen is an optimal size. There's a real community spirit here. So we already know people that are here that want to join the clinic, people that are going to come in and join the clinic. Some of our challenges are in smaller communities. And though, how do we put people together as a team? So not every person has to be in the same space. Some people will be in towns 20 kilometers away, but still be a part of a collaborative care team because your charts will be electronic. People can call, they can email or participate. So this is almost an ideal size. We will have a number of practitioners here that is one of the bigger clinics, and a town like this does keep people out of the bigger city. You can always drive there if you want to go to Costco, but you can't always walk down the street and meet a neighbor or a friend or participate in a club. This is kind of like our ideal size.
From a patient perspective, I don't know if Ashley, maybe you want to speak to this at all, but what are the challenges facing patients in this community specifically that this clinic, once open, will be able to address?
So the needs of our patients are all different depending on the size of the community that they live in, and that's part of the planning that Horizon undertakes when we are building these collaborative care teams, is to understand the unique needs of the patients within that community so that the team is built with the right professionals to support the needs of those individual patients coming into the team.
Why make the announcement today and not wait for the new facility to be open?
I can
I was trying to put you there.
I can speak to that because we want to reassure community members the commitment has been made, the budget has been allocated, the space has been identified, the lease is in negotiation, the recruitment has started for the new healthcare professionals, and I think folks were asking us, you've forgotten about us, you're not doing anything, it's not going to happen. And we wanted to let people know it absolutely will happen. It's going to happen very soon because we've put the money there. We've identified the space thanks to the community, and the recruitment is underway. And so the 9th collaborative clinic is in St. Stephen, and we were committed to that promise, and we're delivering on it.
Will it be open by the end of 2025, do we think?
You'll be hard pressed to get contractors getting renovations done through December and Christmas. So it's going to be in early 2026.
I'm gonna ask another one. Avery got 4, so. I know today is about St. Stephen, but obviously St. Andrews has put in a tremendous amount of work with Dr. Julie Lebeck-Taylor. I'm wondering where you're at on that. I know that you've signed a memorandum, Horizon has signed a memorandum of understanding with them for renovations. Where are you at with that collaborative care clinic?
Close. Close.
Can you tell me anything more?
Well,
How
I can't
close?
tell you more. This is one of the clinics that we have identified. And, like here, we have a space that's been identified. St. Andrews has a space that they currently reside in looking for some renovations. So we're very close with St. Andrews as well. And St. Andrews will combine with another community that, I forget, it's
St. George?
St. George, I'm sorry, thank you. Where the physicians and the caregivers might work in 2 places, but there'll be one collaborative team. And they are looking at bringing on people this coming summer, new graduates that will be part of that team that will give better, more care to more people. So we're close at St. Andrews as well.
Thank you.
I know that you can't disclose the location, but you were mentioning that some policies had to be changed to allow this to happen. Could you please go into a little bit more detail about that and the challenges of finding the right place that's not in the hospital, but also to have it be, work with everybody that's going to be a part of it?
I appreciate you recognizing that the space challenges are real, right? There may be available real estate, but for it to be optimal for a healthcare facility that's going to work to modern standards and support a flow of team-based activities so that it has great places for patients and their family members, the right kind of spaces for the team to see patients and deliver. It's not just any space that works to those specs. So there were a lot of places considered and a lot of evaluation, which is why there's a lot of renovations that will need to be done to the space that we're acquiring. The policy change was one, it was more bureaucratic, but there was a limitation on our ability to acquire spaces over 5,000 square feet, which is clearly what we need to serve the patients here. That said that DTI had to take over and do the building and the management of spaces over 5,000 square feet. And as I think the previous government learned, that slows things down immensely. And it means that projects take much, much longer. We wanted to be able to enter into leases for space bigger than 5,000 square feet, but we had to make a policy change through cabinet in order to be able to move at the speed that this community deserves.
Well, thank you very much, everybody, for
Thanks,
coming here
everyone.
today.